Honorable Chairpersons, Vice Chancellor Professor Tripathi and formerly Director of Institute of National Importance at Jamnagar, Institute of Teaching and Research in Ayurveda, Professor Anup Thakur, Professor Alex Henke, and all the delegates present in this hall. It's given me a great pleasure to share a few of my experiences on this topic, diabetes, about the concept and management. It's a very common problem nowadays, considered globally. It's not moving. Yeah. So this survey of 21 shows that the prevalence of diabetes worldwide is more than 10%. And by 2030, the number of the patient will be 643 million. And by 2045, the number will be 783 million. Huge amount is invested for this care of this problem, $966 billion, and 6.7 million deaths reported in survey of 2021. 541 million people have impaired glucose tolerance, which are the risk factor for type 2 diabetes. And as Professor Alex Henke was talking about the Sushrutas Shadkriya Kal, the 6 stages of the evolutive process for the development of disease. And if we are able to identify patient at this stage and we adopt proper dietary and lifestyle care, the further progression from metabolic syndrome to prediabetes and from prediabetes to diabetes can be arrested. So that concept is a very important concept of the Shadkriya Kal of Sushruta. In India also, more than 11% population is suffering with this disease, and 15% people have the pre-diabetic stage. It is more seen in the urban area rather than rural area, and the persons who have associated high blood pressure, they are more risky to develop this disease. In Ayurvedic literature, it is very clearly mentioned that the patient is passing urine in excessive quantity and frequency is also increased, and the causative factors, diet related, are the factors which are rich in this carbohydrate and fat. So metabolism of fat and carbohydrate is disturbed. So milk product, jaggery product, all are considered as risk factor. And in lifestyle, the sedentary lifestyle, lack of exercise, day sleep, and other stress-related psychological factors are also described among the causes. Before the disease develop the symptoms, there is a concept of Purup or prodromal symptom or premonitory symptom. And very clearly it is told that the sweetness in the mouth and sitting of fleas on the body, swarming of ants in the urine, that clearly shows the concept of glycosuria and hyperglycemia was well known to them. आप हलवाई की दुकान पे जाइए, मिठाई में जैसे मक्खियाँ भिनकती रहती हैं, ऐसे ही प्रमेही के पेशेंट में मक्खियाँ जो है वो बैठती रहती हैं. That shows the blood glucose level is very high. The Sushruta says patient may be of Sahaj and Apatya Nimittaj, the genetic paradigm of disease and defective diet and lifestyle. That so the previous one is more favorable for insulin dependent, and the Apatya Nimittaj goes in favor of non-insulin dependent, which is considered as type 2 diabetes. 3 stages are mentioned: Kapha Prameha, Pitta Prameha, Vata Prameha, which can be considered as early diabetes, acute diabetes, and chronic stage of diabetes. Sushruta has classified the symptom based on body constitution. Patient may be stool or obese, and patient may be asthenic or lean and thin. Again, the Krish Pramehi are those patients who in the beginning may be non-insulin dependent, but very quickly they develop insulin dependency. And the obese patients are certainly type 2 or non-insulin dependent. They have also mentioned, based on all these things, the patient who can be managed easily, and the type 2 patient, obese diabetics, and early stage that can be managed easily, and the patient who are Sahaj Prameha, Sushruta mentioned because of the defective ovum and sperm. Charak has mentioned Jata Pramehi Madhumehi Nova. So when the patient is developing disease from the very beginning, that is also of asadhya category or unmanageable category. And as Sushruta says, Sarve Pramehastu Kalena Pratikarana Madhumeha tu Mayanti Tad Asadhya Bhavanti. In due course of time and due to improper management, all types of Prameha are landed to Madhumeha, which is terminal stage of disease and said to be incurable. So Madhumeha is a subtype of Vatach Prameha. We can understand Prameha which include all three conditions: metabolic syndrome, pre-diabetes, and diabetes. Obesity is the main component, which is because of the kapha dosha dominance. And in all these obese diabetic patients, especially who have abdominal more fat, so they develop insulin resistance, and they are in favor of type 2. And according to Ayurveda, these are Sthula Pramehi, and this metabolic syndrome where you find central obesity, high cholesterol, and low HDL, high LDL, hypertension, insulin resistance. So it is all because of the defect in the Medha Dhatu, and you can consider it under dyslipidemia. So main problem is insulin resistance, dysfunction of the beta cell, and genetic susceptibility plays a very important role, leads to type 2 diabetes, where more than 80% patients develop insulin resistance. And increased food intake and obesity increases the insulin in the circulation. This increased insulin through negative feedback process reduces the insulin receptor in the target cell. That's why there is less responsiveness for utilizing the glucose. As soon as you are reducing the weight, you are reducing the obesity, these insulin receptors are again regenerated, and that's why there is increased responsiveness for glucose utilization. That is the reason that by diet control, by weight reduction, the blood sugar level goes down. Prameha, Madhumeha, both words, terminologies are used for this disease. And when we talk about management means samprapti viktan, the disintegration of the pathogenesis. Ayurveda talk about involvement of 3 doshas and 10 dushyas. So all the medicine, we should not unnecessarily go for hypoglycemic or anti-hyperglycemic. You will have to consider from viewpoint of taking care of dyslipidemia also, inflammatory conditions also, and so differently they have mentioned the pathogenesis of Kaphaj Prameha, Pittach Prameha, Vatach Prameha, the excess of growth hormone, give you a biomarker of growth hormone excess for Bahudrav Shleshma, which is a peculiar type of nature of Shleshma in the pathogenesis of disease. In Pittach Prameha also, the high level of catecholamine and cortisol, that plays a more important role. And in Vatach Prameha, the structural and functional changes in the beta cell that leads to the insulin dependency. Mainly 3 types: Kaphaj Prameha, Pittach Prameha, Vatach Prameha. Then they have described subtypes: 10 Kaphaj Prameha, 6 Pittach Prameha, and 4 Vatach Prameha. Only in 3 subtypes, that is Sheet Meha, then Ikshu Meha, and Madhu Meha, the sweetness of urine is mentioned. Rest in other subtypes, sweetness is not referred. That's why the Pittach variants are more indicating the inflammatory condition, and which we find in the metabolic syndrome also. And these subtypes are based on the examination of urine and some associated symptoms. Different colors of urine as mentioned. Haridra mein, turmeric, I mean the yellow urination, Rakt mein, blood-like urine, Manjistha mein, the decoction of Manjistha, Neel mein, vagera, vagera. So in that way, different metabolites are passed in the urine. And in Vata Prameha, they have mentioned Vasa mein, the lipid is passed in the urine, Majja mein, the marrow is coming, and Hasti mein, incontinence leads to the uncontrolled urination, and Madhu mein, which is described as Ojo mehe bhai Sushruta, that immune substance is passed in the urine. On the basis of examination of urine, we have collected the GTT-proof patients of diabetes. Their fasting morning urine was collected in big jar, and then the color, the deposits, all were identified. And in a small series of 27 patients, we were able to identify 11 subtypes of Prameha in these patients. Then in Ashtang Sangrah, they have mentioned the Upadra or complications of Kafaj, Pitta and Vataj Prameha. 2 days before, they were talking about the Prakriti of the people. And when we found that same clinical presentation, same duration of disease, same drug was given, but the response was not same in all the cases. Then we focused that how Prakriti plays a role in the pathogenesis, in the progression, and in the response of the treatment also. So we evaluated the Prakriti of the patients, and based on anthroposcopic features, physiological features, and psychological features. And then also we evaluated the neurohumors, the concept given by Professor K. N. Udupa in Banaras Hindu University to consider biomarker acetylcholine for Vata, catecholamine for Pitta, and histamine for Kapha. I am not saying that Vata is acetylcholine. No, not at all. What I am saying is that acetylcholine and likewise substances could be taken under the broad heading of Vata. Similarly, catecholamine, which is sum total of epinephrine and norepinephrine, that can be covered under the broad umbrella of Pitta. And similarly, histamine and likewise substances can be categorized under the broad heading of Kapha. Since the whole neuroendocrine system is disturbed, so we evaluated these in normal individuals and then in diabetes subjects also. And we have seen that in Kapha Prakriti healthy individuals, the body mass index is high. In Vata Prakriti people, Pondal index, height-weight ratio is high. And in Pitta Prakriti people, the values are in between. Similarly, we have seen that acetylcholine was predominantly high in Vata Prakriti people, catecholamine was predominantly high in Pitta Prakriti people, and histamine was predominantly high in Kaphaja Prakriti people. And we have seen that Kaphaja Prakriti type of diabetic patients, they have a pattern of mild hyperglycemia. Vata's Prakriti type of diabetic patient have pattern of severe hyperglycemia. And Pitta's Prakriti people have moderate hyperglycemia. Similarly, in Kaphaja Prakriti people, insulin was not lowered. In Vata's Prakriti people, the insulin value was hypoinsulinemia or leading to ainsulinemia. So we can say that progression is quick in those diabetes who have Vata Prakriti. The progression of diabetes is slow in those patients who have Kaphaja Prakriti. With advancing the lesion, the fall in insulin and rising pattern in blood sugar is noted, which is more severe in Vata Prakriti and mild in case of Kaphaja Prakriti. When we come to the management, the dietary management, the best food is that which is not sweet, not too oily, and have the ability to mitigate Kapha Meda, and having nourishment type of effect. Warm diet is recommended since it will ease Kapha, normalize Vata, and stimulate Pitta to take care of the digestion. Barley is recommended. Prime Minister talks about Shri Anna, the millet diet. And in this Uttarakhand, Madua, which is known as Ragi in southern India, that is highly recommended. Kodo, that is also called. and even the anti-diabetic biscuits was launched by a Kerala doctor, P.G. Kurup, and the base was this ragi or madua. Again, this turmeric, coriander, cumin, garlic, and fenugreek, and this cinnamon, dalchini, they all have reported anti-diabetic effect. Yesterday, in Ahar discussion, they were telling that every food is maybe have medicine effect, but medicine is not the food. So in that way, all these spices which we are using in our kitchen, they all have known medicinal effect. Of course, Anupan also plays a very important role. Patients are advised to avoid laziness and sedentary lifestyle. Sushruta has recommended regular exercise, brisk walk, jogging, sports, and they have recommended every person, whether Hindu, Muslim, Christian, they should read their spiritual scriptures. That will, Hindu may go for Gita, Muslim can go for Quran, Christian may go for Bible. That will help in developing positive mental attitude and also keep away from anxiety, stress, tension, frustration, depression. So that is the utility of reading the religious scriptures. And as Mr. Dr. Alex Henke also talked about yoga, pranayam, that also help. Many of the asanas have known effect like Paschimottanasana, Trikonasana, Sarvangasana, Yoga Mudra, Pavan Muktasana. They help in stimulating the pancreas, release of insulin. Also, other mode of action are also mentioned. Keep away from anxiety and stress. So, yoga is an integral part of Ayurveda. Remember this thing. So, management of diets, wherever found necessary, you should go for Panchakarma procedures, for purification, especially for obese diabetics. And Sushruta says that the care of the Medo Roga is also the Chikitsa for Prameha Roga. Various herbs, polyherbal combination, herbo-mineral combinations are recommended. And number of drugs in Charak Samhita, Sushruta and Ashtang Hridaya, more than 100 drugs are described. As I mentioned that every drug is not having hypoglycemic effect. Every drug is not having anti-hyperglycemic effect. So, but by different mode of action, they are working to take care of this disturbance in this prameha, metabolic syndrome, pre-diabetes and diabetes. And yesterday they were talking about evidence-based documentation. So scientifically also, a lot of work has been done on Shilajit, which is very good for diabetes, take care of the glycosylated hemoglobin, insulin also. It is a rasayan drug, cinnamomum, tamal, tejpatra, which you are using in kitchen. And pulao is a well-known, take care of the reduction of the fasting sugar, promoting insulin release, taking care of postprandial sugar, and immediate quick action within 2 hours, fall of blood glucose level and jump in insulin. Pterocopper, marsupium, vijayasar, lot of work has been done, reduces the blood sugar, promotes the insulin, and most of the anti-diabetic drugs are kashaya ras, tikta ras, or katutikta kashaya. Tinospora cordifolia, it is also a rasayan drug, having blood sugar lowering action, taking care of the, on streptozotocin-induced model, insulin regeneration type of effect in beta cell is reported. And this in Hills area, on that day, inauguration day, the Chief Minister was referring this Daru Haridra, Berberis aristata. So, berberine is present in Berberis aristata and this Tinospora cordifolia also, that lowers the blood sugar and decreases the insulin secretion resistance, and also help in the pancreatic regeneration. So, it is a wonderful drug, Guduchi and Berberis aristata. Then we mixed Karela, Mamortica charentia in Vijayasar. Then further action was potentiated, and Meshishringi Gymnema sylvester is also a very good drug for insulin resistance, insulin care, blood sugar care, glycosylated hemoglobin, and Swartia cerata. A lot of work has been done by Professor Mukherjee in CDRI, bark of the neem tree, then Acacia ficus glomerata, and ficus, this Avartaki pushpuchu. We have worked on Mamejak, Meshishringi, Jamun seed, And many drugs are not described in Ayurveda like Mamejat, but it came to the Ayurvedic literature from the folklore medicine. So physician can develop his own formulation, Salacia chinensis, then Majufal, and this tribal are using in Palghat area, Curcuma nilingrensis. They give one leaves 3 times for chewing purpose. It has also shown good effect on reduction of blood sugar and promotion of insulin. We have seen that based on constitution, the herbal drugs have shown best response in Kafaja Prameha or early diabetes, and in Vatas Prakriti, the response was not so encouraging. And to take care of the stress, whatever principal drug they were taking, we have added Saraswat Churn, which includes Ashwagandha, Shankpushpi, Brahmi, Jyotishmati, etc. And stress was counteracted, then the control of blood sugar was better. We can use organ-specific rasayana to take care of the complication, especially for dementia, Alzheimer, like Shankpushpi, Brahmi. For ischemic heart disease, Arjun, Guglu, Pushkar Mool can be added. Then for diabetic enteropathy, Bilb, Kutaj, Haritki. Then for nephropathy, combination of Punarnava, Gokhru and Varun. Erectile dysfunction is a very common problem. For that purpose, Ashwagandha, Musli and Mucuna prurens can be taken. For neuropathy, we can use Dashmul, which improves the conductivity of the nerve along with Guglu-based formulation. Diabetic retinopathy, Saptamrit law, and Mahatriflagrat can be utilized. And in nutshell, I will conclude, all the patients of diabetes are not similar. We should take care of the psychosomatic constitution, which plays a role in the progression and prognosis of disease. And based on constitution, line of treatment can also be decided. It is good to identify the alkaloid in the research. There is no problem that develop the faith that this alkaloid helps in the, when we talk about the mode of action. But when it's come to therapeutic application, we should use drug as a whole, because natural combination of alkaloid should not be disturbed. Wherever found necessary, mental health promoting major drugs can be added. Organ-specific rasayana can be added to take care of the complications. Yoga and panchakarma, wherever found necessary, that can also be added. There is no jhagda between between Ayurveda and modern conventional medicine. Both are complementary and supplementary to each other. Wherever found necessary, along with the herbal combination, we can add oral insulin promoter in Vataj Prameha or Vataj constitution. If required, insulin can also be added. Ultimate objective is to take care of the patient, to keep him healthy and happy. Thank you very much for giving me an opportunity to share few of the experience. Thank you.